This is video history from the J. Bay Jacobs Library for the History of Obstetrics and Gynecology in America. It's a nice sunny May afternoon in the year 2000. We've come to a new millennium in San Francisco, California. Talking with me this afternoon is Dr. Leo J. Dunn of Richmond, Virginia, a longtime friend. Leo, thanks for being with us today.
Thank you for having me.
We always begin these videos by starting at the beginning, so tell us where you were born and where your education began.
Well, I was born in Trenton, New Jersey, 69 years ago tomorrow.
You didn't have to admit that.
And had the good sense to leave Trenton in 30 days and went to Long Island, where I grew up, and was educated in rural schools on Long Island. It was rural at that time. My community had about 5,000 or 6,000 people in them, and my graduating high school class had about 24 people.
That's different than most
Yes,
these days.
A bit rural at that time. And then I went to a commuter college, Hofstra College, out on Long Island, which is now a university, and went from there to Columbia University for medical school. And I interned in Cincinnati and went back to New York and did my residency under Howard Taylor at Columbia.
Howard Taylor certainly is a distinguished name in obstetrics and gynecology. Any particular recollections that you have of him?
I was very impressed by Dr. Taylor. He was a mentor to us. He was very busy on national and international things, but he enjoyed being with the residents. And he had created a rather unique residency in those days. It was possible after internship to go 5 years in residency. And if you did that, your final 2 years really were what we now call fellowships, because you did the advanced work in infertility and high-risk pregnancy and cancer surgery. And so it was a rather unique program.
Did you say this, you did it in all three specialties, or was it focused on?
No, all three. You covered
focused on all.
All, yes, you did all of that. And you were the primary consultant for all the other residents when you were in the 4th and 5th year. And so you operated a great deal and made a lot of decisions. And then you used the faculty as your consultants. So it was really a very good program, I thought.
Many of us know, of course, that in those years you were involved with Drs. Gorman and Fredda and
yes,
the beginning of RH, immunoglobulin and the prevention of RH disease. Was Dr. Fredda a fellow resident of yours?
He was. We were in residency at the same time. And at that time, I remember thinking about it, and about 25% of our residents either had a PhD or a PhD candidate. Isn't that remarkable? And out of that group of residents who had been together over the years, about 15 or 16 of them became university chairs in departments of OB/GYN.
We all remember it as a remarkably
It was an unusual
fertile
thing.
department.
Yeah.
Tell me a little bit about, tell all of us a little bit about the RH
Well,
isoimmunization.
Probably none of that research could be done today because it probably broke all the current rules. But the Fredda and Gorman were well-founded individuals. That is, they had worked with basic science mentors and had developed their skills and had a good base of knowledge. And they felt, after a variety of experimentation, that they knew the way in which RH immunization could be prevented. And so they brought their proposal to the warden at Sing Sing, and they used male prisoners to do their clinical studies. Probably couldn't be done now. And they had very little money. They were able to scrap together a little bit of money out of the city of New York, actually, to get this started. And they worked very hard because this was work they did in off hours. They were both continuing their residencies during those times. And they really got to a point where they had proved the point But Vince Fredda is very compulsive, and he was not going to publish anything until it was so secure that nobody could challenge it, beside which he wanted a long-term follow-up on these prisoners to be sure that late immunization didn't take place. And for that reason, some of the British investigators stepped in ahead of them in the literature, but actually published early results that later studies showed had not worked. And so Fredda and Gorman got into a bit of a controversy, I guess. I think if it hadn't been for that, they would have gotten the Nobel Prize.
It was a remarkable time, and I know that you were a part of it at the time.
Interesting.
After Columbia, you went where?
Well, I took my first faculty position at the University of Iowa with Dr. Bill Keetle. I wasn't sure that I should be in academic medicine, and my first interest was in maternal fetal physiology. And I had been accepted to go to Yale with Dr. Donald Barron. And that was all set. And that was a big sacrifice because, you know, we had very little money in those days, and to another year of training after having had 6 years of training was a lot. And
were you married then?
Was married and had a child. And Dr. Barron called me up crestfallen one day because one of his former trainees had just been released from the military unexpectedly, and he only had so many rooms, spaces at the bench, and so he said I'd have to wait a year. Well, I took the position at Iowa, and then it was really not possible to turn back again after that.
How long were you at Iowa with Dr. Keetle?
5 years, and because I had cancer training and they didn't have somebody doing oncology, my whole career changed from being interested in maternal fetal medicine to oncology.
Dr. Keetle certainly had the reputation of being a mentor who filled up departments across the United States with his trainees and other people that he knew, and I suspect he gave you this kind of guidance as well.
He did. Dr. Keetle was an outstanding person,
He was indeed.
and it was an outstanding department. The reason I went there was that it was the purest form of academic medicine and OBGYN that I could find in the United States at that time. I mean, it was really the model, I guess, that a lot of programs fashioned themselves after in the future. And he gave me a great deal of help in my career. And you know, the incoming president of the college, Dr. Purdon, was one of his residents.
Yes.
So,
well, and there have been others.
And there have been others.
There have been others as well. Where did you go from Iowa?
well, I didn't meander very much. I went from Iowa to Richmond, Virginia, to the Medical College of Virginia, and remained as chairman there for 29 years. And I retired that position.
Kind of
3 years ago.
longevity one doesn't see anymore.
Yeah, I suppose that's true.
What kept you loyal to Richmond? I'm sure you had other offers, bigger schools, bigger places.
Yes.
Not that it wasn't a fine place, obviously, but.
Well, I would have to say there were a lot of opportunities for me. I was very grateful for that. And my wife Betty and I sat down, and seeing that there were opportunities coming up, I had to decide what direction my career would go in, whether it would be in research or in clinical work and teaching, administration. And having had such an extensive period of clinical training, it seemed unwise to turn around and let that go. And Lauren Woods, who you may have known, head of pharmacology at that time at the University of Iowa, advised me that I would have to go on and get a PhD if I wanted to go on in the area of oncology, which is what I was then doing. So I decided not to do that, and I went interviewing for chairs. I was invited to look at 5 chairs before I was 35 years old, and so that sounds like a compliment to me, but the fact is that there was a void in OBGYN at that time. So we discussed it, and we thought that the program in Virginia was one that needed a great deal of work, and we could devote our lives to that. And other opportunities came up, but we felt that we should do one thing right, and that's why we stayed.
You certainly did.
Well, thank you.
at that school. Now, in addition to all of the good things that you did in education there and certainly in oncology, you've had lots of other impacts on education in obstetrics and gynecology. Tell us about some of the offices that you've held and things that have occurred in OBGYN education.
Well, the education and administrative things were the areas that I really focused on. And I became involved with ACOG. I was very interested in that. And Dr. Keith Russell and Howard Taylor had a lot to do with the formation of ACOG, and I thought that they were very wise.
The late 60s, early 70s, something about like that, wasn't it?
Around that time, yeah. And in a way, it was a little late in formation, but they saw the need and moved on that. And I think that had a great deal to do with improvement in education in OBGYN. I also became involved with Charlie Hunter, who you remember very fondly. And Charlie got me involved with the work of the foundation.
The foundation of?
Well, it's now AGOS. It's one of the parent.
And the American Association.
It was the association originally, and then when the two organizations merged, they kept the foundation and kept the name, actually. That foundation put out a great deal of effort in teaching young faculty in OBGYN how to teach, how to write examinations, how to develop objectives for education. And I became involved in that, and that carried me on through into CREOG. What I learned there, I was able to use later when I became a member of, a director on the American Board of OBGYN, because one of my early tasks there was to take charge of the oncology division. John Lewis was the first head of oncology, and I was the second head of oncology. And I was able to take what Charlie and the foundation had taught me, and we developed the first objectives for fellowship training.
You began this before the present fellowship system existed.
It was in the beginning of it. And we used the people who had taught us from the University of Washington. We had them come in and work with the members of the oncology division. And that was carried forward after I left the division, and oncology became the pace setter, really, in the board for doing their examinations and those things. And then I went on and became the president of the board after that.
When did fellowship process formally take place in the board? The exams began and that sort of thing?
That was probably early 70s, because it was soon after I went to Richmond that that was formalized.
It's been longer than I would believe if I thought back about it.
Yeah.
And, of course, then as a result of your work with the American Board, you went on to other things in the general supervision of education. Tell us about those.
Well, in the area of education, I became involved in the areas of accreditation and certification. I became a member of the RRC, and I thought that was a very good learning experience. And of course, in all of these activities, you work with just great people. It's one of the pleasures of being in academic medicine. From the RRC, and through the board, I became a representative to the Accreditation Council of Graduate Medical Education and the American Board of Medical Specialties. And over time, working in their committees and doing those sorts of tasks. In recent years, I was the head of the ACGME, and now I've just completed the presidency of the American Board of Medical Specialties.
What have been the challenges of those? I know there have been many of ACGME and ABMS in, say, the past 5 years or so.
They're considerable. The ACGME You know as well as I do their past history and how they were put together. But as I got to know them closely, it was still an organization in formation. I knew the history well because Clyde Randall, who you remember very well, kept us really apprised of our history. And as I looked at the ACGME, I saw that there were some painful things that had to be done in order to make that a more effective organization. I was head of the ACGME for only 1 year, and in 1 year it's very hard to get anything done. So I set out a strategy working with other people in ACGME who were of like mind, and we accomplished, I would say, 3 things in that year. One is we got the ACGME to change the bylaws so that the head of ACGME, the chair as it's called, would have a 2-year tenure. It was only 1 year before. And changed the method of electing officers so that they were selected by the council rather than just appearing in rotation, so that they had a choice. So those 2 things got done. And then the painful thing was to make the ACGME an independent corporation so that it was no longer controlled by the AMA. My friends in the AMA would not like to hear me say that, but it was
a stroke of good judgment.
And it was an out-and-out struggle. And I'm pleased to think that this fall, the second reading of the change will take place and they will be independent. So the ACGME, I think you'll find in the near future will be a much more effective organization.
I think it's fair to say that among all obstetrician gynecologists, or perhaps anybody, your career and the structure of organized education in medicine has been about as comprehensive and effective as anybody's.
Well, it's been good fun. And I'd have to say that it's not hard to do that from the standpoint of obstetrics and gynecology, because our specialty has really approached things in a very fundamental way. And so those of us who have participated in the activities of the college and of the board, when we go into these things, we really have a very good, solid background in what's happening. And so it's not sort of such a difficult jump.
In saying that about you, I think it's also fair to say that you've been actively involved in patient care and areas of primary care and obstetrics, yes, gynecology, and things such as that.
I continue to practice today, although this is probably the last year that I will do that.
You've been associated with a lot of father figures, if one will, in the course. Who do you think was your most important mentor?
Well, it would be hard
Maybe
to choose between Bill Keetle and Howard Taylor. 2 of them influenced me very much. I would say that Dr. Taylor influenced me more by, he was such a visionary person, and I didn't have a close personal relationship with him, although he was very friendly to me. Dr. Keetle, on the other hand, was more of a hands-on kind of person, and you really had a close personal relationship with Dr. Keetle. Those 2 people influenced me very much.
Well, their influences were good because your career has certainly been outstanding.
Well, thank you.
Leo, thanks for talking with us on this afternoon in the year 2000. It's been great to have you here.
Thank you for having me.